Okay, so today I'm going to be demonstrating on how to give oral medications and injections. Getting ready to give my 7 o'clock meds to Mr. Truman. I have checked the doctor's orders against the MAR. Everything looks okay. I did a little background research, and the medication that he has prescribed goes along with his diagnoses. I also checked to see if anything would interact with each other, and I did not find anything except for the Bactrim, but we'll get to that later. So I would check my labs. He is going to be having furosemide, so I will need to check my bun and my creon to make sure his kidneys are working. I would have to check electrolytes, being that the furosemide is a diuretic. It can cause electrolyte imbalance. Also, I would have to watch his fluid intake and output, especially potassium. So I've looked at all that. His labs look fine for that medication. The other medication, pantoprazole, I would check magnesium. Sometimes long-term use can make the magnesium levels drop a little bit, but that looked fine, so that'll be okay. And then insulin. I will be checking his blood sugar, checking how he's been running. Okay. Hello, my name is Rhiannon and I'm from Highland Community College. I am a student nurse. I have my instructor with me. She's going to be watching what I do today. Is it okay if I provide you with your injections and your medications? Thank you. Can you tell me your name and your date of birth? And then I would check it with the record that I have in front of me, which is going to be the MAR. If I had a scanner, I would scan his bracelet too. Okay, state your name and your date of birth. Okay, and then that checks out. Mr. Truman, do you have any allergies? At this point, I did look at the record and it shows that he is allergic to sulfa. However, I'm not giving any medications that have sulfa in it. I also wanted to check that he didn't tell me any other allergies that weren't in the record, because sometimes they forget, so I wanted to verify that. Mr. Truman, I'm going to have to do some assessing with some of your medications. I'm going to get your weight, I'm going to get your blood sugar, and I'm going to be listening to your lungs and for bowel sounds. So, for the furosemide, I will get his weight. If there's a 2-pound difference in a day, I'd be notifying the doctor, either if it's up or if it's down. Monitoring, see what his output's been. His labs were fine for the kidneys. Electrolytes looked good too. So I would assess his skin. I want to see if there's any rash or if there's any opened areas. I would document any edema that I have found, the location and the depth. And then the lung sounds. And I would even go ahead and take his blood pressure and pulse. Okay? Mr. Truman, have you had any symptoms of dizziness or muscle cramps? Do you feel like your blood sugar is low? I would want to ask him how he's feeling and if he's having any symptoms that could be a reaction to any of the medications that he's been getting. Okay. All right, so Mr. Truman, I'm going to go ahead and get your medications ready. So I'm going to do hand hygiene. And by the way, I have closed the curtain, provided privacy, the patient's safe. Hand hygiene. Okay, so your first one is your furosemide, Mr. Truman. This is your diuretic, so this will make you urinate. You're going to need to use your call light today to get up, and we'll assist you to the bathroom. I do need you to drink some more water. I don't want you to urinate more than what you're putting in your body. Okay, so furosemide. I'm going to compare it to the MAR. 40 milligrams, 700. Okay. All right. Let's see. And then your pantoprazole. Are you having any heartburn or any discomfort? This is to decrease your stomach gastric acid. Okay, so I'm going to check it to the MAR, pantoprazole, 20 milligrams, 7 o'clock. Okay, and the garbage. And of course, I would mark it. When was your last bowel movement? Okay, and then I would assess his abdomen for bowel sounds. I would even palpate, make sure there's no inflammation going on, or make sure like I can't feel anything that's not supposed to be there. So this will be for your heart, your indigestion. Okay, and then I'm going to give him a full glass of water. And then have him take it. I'll make sure the head of the bed is up so that way he can take his medication. Thank you. Okay, so if you have any muscle weakness, cramps, lightheadedness, I would like you to ring the bell later on. I'm going to go ahead and draw up your insulin. Mr. Truman, at home, how do you do your insulin? I'm going to ask him if he draws it up in 2 separate needles or if he draws it up in 1. I'm going to draw up in 1. What was the last site that you had done? Of course, I would have already looked in my MAR. I would assess that site for any redness or a sign of infection. For this demonstration, I'm just going to give it into his abdomen. And I'm going to make sure that there's another nurse with me too when I draw up this insulin, because it can cause, it's a high risk medication. So I checked his blood sugars and they were fine. They've been running okay. For his injection I'm going to do the abdomen, so I want to stay in the 2-inch radius around the umbilicus to prevent any vascular punctures. I do have his tray ready because this is his insulin regular is going to be fast acting, so it'll start working in about 10 to 15 minutes, and I do not want him to have a hypoglycemic effect where his mental status may change. He may get tremors and shaky. So with this, I'm gonna have my nurse with me. And being that I have to draw up 2 insulins, I'm gonna do another check. Regular insulin. Units are, okay, and then the MPH I'm checking. 5 units, and then the expiration dates, they're not expired. You would get rid of these after 30 days. You find them in the fridge, and when you're not using them, put them back in the fridge. For your NPH, you would want it cloudy. If it is not cloudy, roll it. If it does not mix up and become cloudy, you need to call the pharmacist and get a new vial. Okay, so we are going to give it into his abdomen. And I'm going to go ahead and do some more hand hygiene just because I touched everything. And I'm going to get some gloves. Now for the insulin, I could give it in the back of, or in the back of the arm where there's fat. I don't want it to go into a muscle. I could give it to him in his thigh, his abdomen, and it's sub-Q. So I'm gonna check the expiration date on the needle. Okay, and then I'm gonna have my nurse with me. Being that we're going to draw up 5 units of each, I'm going to need 10 units of air. I will inject 5 units of air into the NPH one, and then 5 units into the regular, and then start drawing up from the regular. So 10 units. It's okay to get more than 10 units of air too. Okay, I'm gonna grab an alcohol swab. And I'm gonna clean off each vial, about 10 to 15 seconds. Okay. Toss this in the garbage. Okay, so I'm gonna do another last check, and I'll have my nurse do it too, or my instructor. Regular, 5 units adult dose. NPH. Okay, I am ready. A-okay. So I'm gonna inject 5 units of air into, the NPH. Okay, and then I'm going to inject the air into the regular and draw up 5. Okay, and I'm going to put my cap back on because I don't think one hand, got this mixed up very well. It's supposed to be cloudy. Okay, and then A-okay. Stick it in the NPH and then draw up 5 more. If you get too much, you'll just have to start over. Okay, and then I would have my nurse verify. No bubbles. Okay, now I'm gonna cap one hand. Okay, Mr. Truman, is it okay if I pull up your gown? I'm gonna give it right here. So I will go ahead and take an alcohol swab, start in the middle and go out. Let it dry. For this, I'm gonna use the Injectipad. So, start in the middle and then go out. We're gonna let that dry. Okay. And of course we know that this doesn't dry very well, so I'm gonna go ahead and just pinch the skin a little bit. I'm gonna go at 90 degrees. If he was emaciated, malnourished, I would actually go to 45. And obese people, you go 90. So on 3, you're gonna feel a pinch. 1, 2, 3. And slowly inject. And straight out. And then cap, safety, into the sharp. I would document the area that I gave it in. He's not bleeding. He shouldn't bleed. There isn't a lot of vascular there. How was that? And how are you feeling? All right. So I'm gonna do hand hygiene. I have your tray waiting for you. You will need to eat within the next 10 to 15 minutes because one of your insulins is fast acting, so it will start bringing your blood sugar down. So you need to eat to get it to stay neutral. Do you have any questions for me? Of course, like I said, you would put these back. Okay, so then I would make sure that he has his call light. The bed's down, the brakes are on, safety. Okay, if you need anything, just go ahead and pull your call light. Again, just if you start feeling dizziness or nauseated, muscle weakness, pain of any sort, go ahead and just push your call light for me, okay? Thank you.